Hello, I'm Sarah Shackass with Real News Communications Network, and I'm talking to Dr. Al Johnson with Johnson Medical Associates a little bit about April, and it is World Autism Awareness Day, April 2nd. So we wanted to talk a little bit about what this means and a little bit of kind of about what goes on with autism. And after extensive research, I was looking, it says that a lot of research studies have shown that gastrointestinal issues could come with it, anxiety disorders. Can you talk a little bit about this?
Most definitely. Autism is really a big problem, and particularly for the parents, and then what's going to happen with these individuals as they grow older.
Sure.
So what we're trying to do is optimize treatment early on to figure out what has actually happened, what aggravates their conditions, and as you just said, multiple things do affect the kids that have been classified in the autism spectrum. Just a note, autism spectrum now includes birth injury. So what used to be kind of cerebral palsy sometimes gets pushed over into the autism spectrum. So what we see is that there's a whole variety of things that can happen. Some of them just are developmentally delayed and have speech delay. Other ones have, in addition, gastrointestinal problems where they have diarrhea, constipation, poor digestion, abdominal pain. A lot of these kids have food allergies, so that they may be gluten sensitive, they may be dairy sensitive. Those are the two main ones, but they may have other specific food sensitivities with that.
So how young can autism be diagnosed? Is it something that you can see at birth, or you can tell with some sort of kind of testing, or is it something that you find out later in life as the child starts to develop?
Well, usually there's a history of the child doing well until about 1 year of age, or 1.5, 18 months years of age, and then they have a marked decline. So they have normal activity, muscle, speech, and then all of a sudden they may quit talking, withdraw, start their stemming activities where it could be rocking or repetitive movements, and become non-communicative. This is the typical picture. There's some that are just slow in progressing, and so that may be from birth, and that's more of something happened at birth that caused decrease in blood flow to the brain. It could be some viral infection that happened during the pregnancy, but they've had problems from birth. Then that fits in a little different picture.
But it's not necessarily only genetic or anything like that.
No. And so they've looked and looked to try to figure out what all the components are of autism. They're still in the research mode. You hear different stories about what is the sequence of events. But regardless, in helping these kids, some of them have nutritional problems, so you have to get the right nutrition. You have to have them on the right diet. You help them with occupational therapy, speech therapy. And then one of the things that has helped the cells heal has been hyperbaric oxygen treatments. And I see a number of autistic kids that have a developmental delay and speech delay. They've worked with OT, speech therapy, PT. You put them in hyperbaric and they're able to get better muscle tone. They begin to speak. They begin to be able to focus on the parents, have better eye contact, calms their behavioral abnormalities down. So it's been really satisfying to work with these autistic children from all the aspects. I have a speech therapist here in the office that works with speech. Most autistic kids are on OT-PT, and then I make sure before we treat them with hyperbaric that they're on a good, healthy, non-reactive food diet for that individual person. And it may vary from individual to individual, but as I said earlier, most of them have gluten sensitivity or dairy sensitivity or both. Now, if the kid does not have abdominal pain, does not have stinky bowel movements, then they may not have the food sensitivity component. And I see a group of those where they just have the developmental delay and the speech problems.
So it sounds like there really isn't one specific plan for everyone, but the hyperbaric chambers help so significantly. Can you tell those who might not be familiar with what the chamber is, why it's so helpful, and exactly what it does when it comes to oxygen therapy?
Hyperbaric oxygen therapy involves putting the individual in a chamber. It's under pressure. They breathe 100% oxygen, and it increases oxygen to all the tissues in the body, including the brain. Over a period of time, it promotes healing, and it's healing a lot faster because you need glucose and oxygen for cells to function. You force that with the increase in oxygen, and you have healing. We use it in wounds all the time for diabetics where there's poor circulation. It works for reflex sympathetic dystrophy and a whole bunch of other problems where there have been tissue injury. So it makes sense that it works for autism also.
Yeah, absolutely. And if people are in the beginning stages, they're just finding out that their child might be autistic or they're seeing some differences, what are some good questions to ask? And if they come to you, what are some things that you're going to be looking for?
Well, number one, you look for what are all the elements as we've been talking about. I get a history of sequential developmental paths, time sequence in it. When did you first notice changes in your child? Then look at the different areas that the child's having problems and define which ones need to be looked at. So if they have gastrointestinal problems, then we look at the gastrointestinal part, as well as making sure they're working on the other parts, making sure nutrition's right, they're eating well. A lot of these kids are really picky eaters. So it really is difficult to try to get them on a diet that they're not allergic to or not reactive to. There are specific tests that can be run to define delayed food sensitivity, gluten intolerance, and I do all those tests. So we figure out exactly what needs to be done. There's no guessing to it or try this, try that, because that can really get frustrating. But we know from our testing exactly what the process is or what their intolerances are, and then set up a program for them so that they can get as healthy as possible and progress and start to heal.
Sounds like a really great option. Dr. Johnson, if people have questions, they want to find out more about you, what's the best way to get in touch?
The best way is call the office at 972-479-0400, or you can go on the website for johnsonmedicalassociates.com and click through it, and there's lots of good information for you.
All right, Dr. Johnson, thanks so much.
Thank you.
All right, for Real News Communications Network, I'm Sarah Strackhouse.